Good afternoon to the ladies and gentlemen of the Virginia Senate Committee who are currently considering the outcome of House Bill 346. My name is Kyle Phillips. I am a registered nurse licensed to practice in Delaware, Maryland, and Pennsylvania, a member of the American and Delaware Nurses Association, American Psychiatric Nurses Association, and a student member of the American Academy of Nurse Practitioners. I am here today to speak to you regarding my support for passage of this legislation, House Bill 346. House Bill 346 is a change to the current nurse practitioner practice legislation being considered by this esteemed Senate group, which would remove the barrier of physician supervision over nurse practitioners as the current law requires. Implementing House Bill 346 would support a collaborative relationship for nurse practitioners and physicians and open up the availability of patient-centered healthcare to all Virginians. The current legislation in Virginia for nurse practitioners is to be able to practice and direct or provide care to thousands of Virginians who need their services, requires a nurse practitioner to perform, quote, in collaboration with and under the medical direction and supervision of a licensed physician, unquote. This requires the nurse practitioner and physician to develop a written protocol and guidelines to address areas such as case review, availability of physician for collaboration, case outcomes, and chart review of the patients that the nurse practitioner cares for. This type of oversight and review must occur periodically under the current law, which requires physician access based on geographical locations, and the very ability of the practice of the nurse practitioner is dependent on this type of arrangement and contractual agreement. Without existing within the strict guidelines and provisions set forward by the supervising physician and nurse practitioner, the nurse practitioner is unable to practice and utilize the full scope of their education and training. The current legislation places nurse practitioners and those that they provide care to in a perilous position. The law, as it currently stands, would create a situation where nurse practitioners would have to cease practicing should the supervising physician retire, fall ill, or leave the state. This cessation of their practice would leave many Virginians vulnerable to losing what may be the only provider of health care they have access to. With the current nationwide healthcare reform working its way to full effect within the next 2 years, there will be millions of Americans and Virginians who will have access to healthcare that was not previously available to them. Here in Virginia, the uninsured is estimated to be between 11 to 16% of the total population, and in comparison to the nation, Virginia ranks 25th in uninsured people among all states. This means that a great number of people who currently do not have insurance for health care will have health insurance made available to them and will be in need of providers of health care to meet their demands. In December of 2011, the state of Virginia assessed its role in healthcare reform and found that the areas that require, in their words, quote, considerable attention were as follows. First, to improve access to healthcare services, especially for the uninsured. Encouragement and strategies for healthier living for the Virginia population. An improvement in the quality of healthcare delivered from all providers. And finally, a cost-effective delivery of care or services for the aged and disabled Medicaid recipients who will be enrolled under the new healthcare reform. I am here to tell you, nurse practitioners can make huge impacts in these areas of need. The Virginia Council of Nurse Practitioners and the Medical Society of Virginia have worked extensively on addressing the issues that would occur by making changes to the current law through the passage of House Bill 346. Their findings show that passing of this bill will promote nurse practitioner practice in the state and will support in retaining nurse practitioners currently practicing and attract more nurse practitioners to practice in Virginia. House Bill 346 will allow nurse practitioners to function to the full extent of their scope of practice, education, and training. It will allow for greater mobility of nurse practitioners while retaining physician support. This mobility will allow for more health care coverage to underserved Virginians in need. Furthermore, passage of this legislation would move Virginia closer to fulfilling the needs of the federal and statewide health care reform that is currently underway and joining with other states in this nation in allowing nurse practitioners to practice without physician supervision. By passing House Bill 346, the goals of the state for healthier Virginians will be closer to being achieved. Nursing as a profession is best suited to address healthier living through education and treatment planning. Advanced practice nurses, being able to work with greater freedom, will be able to provide this care as well as manage the overall health of the patients they serve. By expanding the ability for nurse practitioners to practice, the access for healthcare will be expanded to all Virginians, particularly the underserved, and make more healthcare providers available to the 11 to 16% currently without healthcare. I ask you, should corrections to the current legislation be made? Should the laws of Virginia reflect the desires of the Virginia Council of Nurse Practitioners, the Medical Society of Virginia, and the Virginia Health Reform Initiative, who all concur with the expansion of the role of nurse practitioners? Should the laws of Virginia reflect what will best serve the people of Virginia? I say yes. This expansion would provide improved working relationships with physicians and nurse practitioners. It would provide access to more healthcare providers for all services, but in particular the much needed area of primary care. This expansion would allow for better service to the people of Virginia and provide them with better outcomes when they fall ill and healthier lives in general through focus on achieving the stated goals of the state of Virginia for the health of its people. Thank you.